Hi, I'm Dr. Sarkis Bedikian, and I'm an orthopedic surgeon that specializes in hip and knee surgery. If you are experiencing hip pain, and on top of the pain, finding that it's tough to do the simple things in life, like going to work, playing sports, it's difficult to pick something up from the ground, or even getting in and out of your car. It may be pain that bothers you and wakes you up in the middle of the night, pain that is constant and debilitating enough where you need to seek orthopedic treatment. If any of this sounds familiar and may apply to you, I invite you to come and see me in my office so you can be properly evaluated and we can come up with a treatment plan. You will be greeted by the front desk who are going to walk you through. You will have a set of x-rays. We will sit down together, go over what's been going on, how it's been affecting you, any treatment you've been having, and how we're going to solve that problem altogether. So this is the hip, and basically it's made up of a ball and a socket. So the cartilage is the covering of the bone. That cartilage protects the bone, like the tread on a tire. But as that cartilage or the tread starts to wear down, the ball and the socket will narrow that joint space, and you'll become bone on bone, and it's rubbing and causing pain. Think about bone on bone as a bald tire, but on the socket itself. If you are diagnosed with arthritis, and that arthritis has gotten to the point where nothing provides you pain relief, your lifestyle is severely affected, you may need a hip replacement. How do we do that? Well, we physically remove the arthritis. We clean out all the damaged areas and then fill these areas up with implants. These implants are made of titanium. This is the thigh bone piece. This will go inside to the thigh bone and eventually grow onto the femur. This is the ceramic ball that sits on top of this device. This is a socket piece. And on the back side of it, it has a coating that the bone will grow onto, just like we saw on the other piece. This is the plastic liner that'll snap in. That will fit into your socket. After those implants are placed into the bone, the head and liner will serve as your functional hip. You now have a titanium socket and a titanium stem. These over time will allow you to have less pain and more mobility. This procedure usually takes about an hour to an hour and a half, but sometimes longer if it's a more complex case. But in a nutshell, that's a hip replacement surgery. If you've elected to have a hip replacement, we'll have a conversation on where your incision is going to be. But I prefer the anterior approach. It means that your incision and all the work is going to be done from the front. So if you were to put your hand on your thigh, right by your groin, that is where your incision is going to be. The anterior hip replacement approach allows you more minimally invasive procedure, smaller skin incision, less tissue damage, but the same amount of work to do the surgery. Your mobility will be better because you'll have less pain after the procedure. After surgery, you're expected to do a lot of physical therapy. The physical therapy is as important as the surgery itself. It is that physical therapy that's going to help reduce your pain and return you back to an active lifestyle. Hip replacement surgery can be a scary thing, but my team and I have many years of experience to be able to help you through the entire ordeal before and after the surgery. But ultimately, this surgery is going to make things better for you. It'll get you back to an active lifestyle. You can play with your grandkids, go to church, have a restful sleep throughout the whole night, even the simple tasks of just enjoying being with your friends and your family. And we are excited about helping you.